South Korean children will be cooped up in their homes as schools across the country remain closed to combat the spread of COVID-19. Gang Mi-rae's office also closed, leaving her to look after her two sons and try to keep them busy.
I help the kids study, cook for them at home, watch TV and sometimes play board games together and spend time reading books. I won't let them kick the ball around in here, but they will get bored.
As a child psychologist, Ms. Kang worries about her children's well-being. She says that relatives of those afflicted are more likely to develop phobias. But her main concern is the virus itself. South Korea has recorded near 1,000 cases and more than 10 deaths.
The virus has spread around hospitals near my workplace, so I was worried about getting it when I went to work. And because they can't stay at home all the time, sometimes they meet friends. But again, I worry about them catching the virus, that anyone along the road may have the virus.
COVID-19 cases have been reported in all major provinces. Kindergartens, elementary, middle and high schools have been shuttered by the government for 2 weeks. Many universities have postponed the beginning of the spring semester, and Chinese students returning here face a 2-week quarantine. COVID-19 cases in South Korea spiked after a 61-year-old woman, now called patient number 31, attended several meetings of a fringe religious group, Shinjonji, in early February, despite suffering a fever and cold-like symptoms and evading quarantine. Mainstream pastors now suspending services to their congregations blame the group viewed by many as a cult and its lack of civic duty for spreading the virus. The Shinjonji Church and super spreader patient number 31 have been identified as the source of more than half of the country's known COVID-19 cases. A special force, including health officials, are racing to locate church members for testing as concern grows the virus may spread nationwide.
And Frank Smith, who filed that report for us, joins us now from Seoul. Frank, South Korea has the highest number of infections outside China now. Do authorities there have any hope of still containing this outbreak?
Well, that's a very good question. In other countries around the world, including the United States, they suggest that the outbreak will spread quite widely. Here, the government announced that there have been 169 new cases today, totaling 1,146, and that's up from 51 just a week ago, including some 12 deaths. These new cases also center more than 150 around the central South Korean city of Daegu, and are also sourced from that one cluster around that church sort of cult called Shinjonji.
Well, tell us more about that church, about that religious group at the center of the corona outbreak there in Korea. Are they cooperating with authorities now in combating the virus?
Well, that's a very good question. This group, their full name is the Church of Jesus, the Temple of the Tabernacle of the Testimony. They're led by a fellow named Lee Man-hee, who suggests he's the second coming of Jesus Christ with particular expertise, unique expertise in interpreting the scriptures. Initially, they were very criticized for not cooperating with authorities. Their website even suggested that followers not report to authorities and continue their proselytizing mission work. They are known to misrepresent themselves in public, infiltrate churches to recruit other members. Their members become absorbed in the group and then neglect their family, their work, and their study and their other lives.
How disruptive, Frank, has this outbreak been for South Korea so far?
Well, it's been extraordinarily disruptive. In the report that we just saw, I mentioned just schools and churches. In fact, it goes across public institutions. Museums and art galleries have been closed. Also theaters and sports venues have been closed. All rallies have been banned here in the country, although a large group that opposes current progressive President Moon Jae-in plans on going ahead with a rally even this Sunday, despite that ban.
Frank, thank you very much for bringing us up to date. That was correspondent Frank Smith there in Seoul, South Korea. Italy has now confirmed that 11 people there have died from the coronavirus. 322 people have been infected, a one-day increase of almost half. This comes as other European countries are recording their first cases. Experts believe travelers are carrying the virus from Italy, which is the epicenter of the outbreak in Europe. They include one of two new cases here in Germany. Italy's health minister has been hosting emergency talks with ministers from neighboring countries and Germany to discuss a joint response. He gave this assessment.
We shared some important points to strengthen our cooperation and stick together. Among these, the most important point is to keep the borders open. Closing borders would be inappropriate, disproportionate, and wrong. All countries bordering Italy have committed to share and standardize information and to share epidemiological and medical information.
Well, for the very latest, let's cross over to Rome now, where correspondent Seema Gupta is standing by. Seema, Italy has decided not to close its borders. Neighboring countries have agreed the same. What do Italians think about this decision?
Well, I think Italians are concerned about the impact this is going to have, not just in terms of their health and security, but also the economic impact if the borders are closed and life or movement as usual cannot continue. Looking at the economic impact in itself, you've got the regions of Lombardy and Veneto. These are some of the richest regions in Italy, and they are the regions that have been worst affected, particularly Lombardy, where the bulk of the infections are. They represent some 30% of the Italian economy. They're concerned about the fact that schools are closed, museums, cinemas, the impact on the economy. Many companies are requiring their staff to work from home. Let's not forget, Italy already has a stagnant economy. So what impact will this have? You've got events like the Salone del Mobile. Now, that's Italy's furniture fair, one of the most important globally. They've made the decision to postpone that till June, which is unprecedented. You have, just to give you an example, it was supposed to be filming in Venice of Tom Cruise's latest Mission Impossible series. That's been postponed. So the impact on the audiovisual industry as well. And let's not forget tourism. Reportedly, there have been some 40% of cancellations at hotels in Italy.
Now, on Tuesday, Italy hosted a meeting with ministers from neighboring countries and Germany. The aim of that was to come up with a coordinated European strategy. Did those ministers deliver that?
Well, what they're saying is that they're going to keep those borders open because, as the Italian health minister said, the virus doesn't follow administrative borders. So there's really no point in doing. In fact, they believe it's counterproductive. Then on top of that, it's about sharing information, epidemiological information, but also working together politically as well as the medical staff and the scientists in order to work together to come up with a joint response. Now, here in Italy, in terms of new measures, they're talking about stopping all school trips right up till the 15th of March. We've got the school closure till the end of this week, and that's going to be reassessed. But there's talk now of possibly extending the school year this year. They're also disinfecting buses and metros because, of course, that's where people come into contact, touching the railings and so on and so forth. The vaporetto or water buses in Venice have also been disinfected. They're also saying stopping blood donations if you've been in those infected areas from the 1st of February. All that said, though, the Prime Minister is very keen to stress that we cannot succumb to panic. At least that's what he's hoping. He's called on the national broadcasters to try and tone down the panic, if you like, or the tone of it, and to stress that while we have seen 11 deaths, they're deaths of, unfortunately, of elderly people who already had health issues, and so their health was compromised, and that a bulk of the cases actually do get cured.
Seema, thank you very much. That was correspondent Seema Gupta there in Rome.